and press record, and welcome everyone to this HVCI webinar offering. We are so pleased that you are joining us this morning. My name is Maggie Dixon, and I am the HVCI Development Coordinator at Prevent Child Abuse New York, and I head up our webinar effort. We are so pleased to welcome Melissa Passarelli from Docs for Tots today to provide a webinar on the ASQ data tool titled Supporting Social Emotional Wellbeing Through Promotion and Screening, Resources and Strategies. I'm here to just provide some very quick housekeeping items. This session is going to be recorded and will be posted on our Home Visiting Coordination Initiative website following today's presentation. I will send a follow-up email with a link to all that information and a copy of the slides after today as well. There are closed captioning services available. So if you head to the bottom of your screen and press live transcript, you'll be able to access those. And finally, the HVCI is a component of the Preschool Development Grant, New York State B5. And a component of this grant is data collection. So we ask that individuals please fill out a survey to provide feedback as a component of the grant after the presentation. I believe those are all of my housekeeping items. Please remember to mute yourselves and turn off your cameras to give the attention to our speaker. And I am now pleased to introduce Melissa Passarelli.
Hi, everyone. Thanks so much for joining today. We'll be talking about how to support social emotional well-being through promotion and screening. To introduce myself, my name is Melissa Passarelli. I am the Director of Programs at Docs for Tots. Docs for Tots is a pediatrician-led nonprofit that focuses on improving outcomes prenatally through age 5. And rather than working directly with children and families, we bring together children's doctors, communities to promote practices, policies, and investments in children from prenatal to 5 that foster children's healthy development. So a lot of the work that we do is with professionals like yourself in what we call practice transformation, so helping translate research into practice. For example, one of our bread and butter programs is pediatric practice transformation, where we work with pediatric providers to implement standardized screening like developmental screening, maternal depression screening, et cetera, at well child visits, so that by the time we leave, they're doing that in a regular way. So they're screening and making referrals. We've also done that with childcare providers, home visitors, et cetera. We also lead up Help Me Grow Long Island, and I'll speak a little bit more about that at the end of the presentation, because Help Me Grows do exist in a few different locations across the state. But in my capacity as Director of Programs at Docs for Tots, I'm also the Director of Help Me Grow Long Island, which is a region-wide partnership coordinated by Docs for Tots based on a national Help Me Grow model with the goal of promoting child development, catching issues early, and successfully linking to services. And then finally, I'm also the New York State Act Early Ambassador for the Centers for Disease Control's Learn the Signs Act Early program. So all this to say is that, developmental promotion and screening is my jam. We do it in a lot of different ways. I'm so excited to be speaking with all of you because I know that child development is important to you as well. Our objectives today are to understand how social emotional development affects the work that you do with families, learn how screening online can be effective, and identify opportunities to utilize existing resources and to partner with others in your community to promote optimal development. Now, I know that some of you may already be screening in your programs. I tried to create content for this session that would be relevant to all, whether you're screening or not. But if you are screening, or if you're not, if you would just chat that into the chat box, let us know, if you're screening, if so, what your process looks like. That will be helpful as I go through. And you can certainly, chat in if you need me to repeat anything or things are redundant. I want to make this meaningful. But I want to start by level setting on what the problem is here and why the early years matter. So when we talk about young children, we're talking about brain development, and brain development is like constructing a house. Like building a house, building a brain follows an orderly process with predictable stages of development. The strength of the foundation matters. Early experiences literally shape the brain, establishing a foundation for everything that follows. And just like a house, if that base is not strong, it can lead to problems later on. And on the flip side, building a strong foundation increases the likelihood of positive outcomes. But we also know that construction is a process, not an event. So development starts before birth and goes through adulthood. The construction can be corrected over the course of the project, but it's easiest and most cost-effective the earlier that we do so. And just like with constructing a building, there are periods of intense activity. So the early years of life, really the first 5 years, account for 90% of brain development, with 700 neural connections being made every second. So that's why we talk about how critical the early years are. I'm just going to pause this for 1 second. For some reason, the timings keep messing up. Hold on. Don't use timings. Okay. There we go. This graph shows the lifespan and how much brain growth is happening at that time. So again, we know that 85 to 90% of brain development happens in the first years of life, and yet it is the most underfunded part of the entire lifespan. So when we're talking about return on investment, we're really missing an opportunity to invest more in the early years. I know that I'm preaching to the choir here. There's been a lot of talk in the past year about racial equity, rightfully so, and I wanted to frame that in the context of early childhood. This is a study that came out in October of last year that used the early development instrument, which is a measure of school readiness in kindergartners across the country. And it looked at school readiness broken down by race and ethnicity, and they found that there was already racial inequities in measures of school readiness. And school readiness has a lot to do with social emotional development, because a lot of the skills that we measure when we're measuring school readiness are, ability to self-regulate, ability to behave in the classroom, ability to make friends, etc. So all this to say that we really need to be looking at these issues in the early years so that we can address inequities early. You're also probably familiar with adverse childhood experiences, and that's the idea that the more toxic stress a child experiences in their early years, it can disrupt their neurodevelopment, which can then impair their social, emotional, and cognitive development, which can then lead to the adoption of risky health behaviors like drinking excessively, using drugs, etc., which could then increase the likelihood of disease, disability, which can then increase the likelihood of early death. And this can be very overwhelming, and I know that we can't do a lot to stop adverse childhood experiences from happening, but we also know that a child who has 6 or more ACEs is 90 to 100% likely to have a developmental delay. So while we maybe can't stop these adverse childhood experiences from happening, we can intervene when it starts to disrupt neurodevelopment and affect development. And so by promoting optimal development, doing developmental and social emotional screening, and connecting to services that can help, we can help stem the tide of this process. Social determinants of health is also something that's been getting a lot more play recently, and that's the idea that typical things that we associate with health, like healthcare and health behaviors, only account for about 50% of health outcomes. And the rest of health outcomes are affected by things like socioeconomic status, family and social supports, educational achievement, etc., physical environment. And the same thing goes for developmental health. So we know that a child's developmental health can also be affected by all of these factors. And yet, it's not all doom and gloom. Everything I've spoken about is an association, not a determination. So we need to be aware of how chronic stress can impact a child, but there's also protective factors that can buffer against bad outcomes that are equally as influential. And these are, resilience. So making sure that parents can cope with everyday stresses of life. Concrete supports. So making sure that families have access to housing, food, etc., to be able to support their child's development. Social connections, emotionally supportive friends, families, and neighbors. And then the two things that we're really talking about today, social and emotional competence. So making sure that caregivers are able to provide positive and nurturing relationships for children, and knowledge of parenting and child development. So making sure that parents know what to expect as their child grows and how to help foster that development, and then what to do if they're not seeing that happening in a timely fashion. So to bring it all back, in the realm of home visiting, you are part of the brain construction crew. So our well-being is built just like a structure. It's influenced by what people around us do and what resources are available. So the adults that raise us, because it does take a village to raise a child, social determinants of health and toxic stress, and the protective factors that can counteract them are all kind of part of that equation. Many specialists and types of materials are required, and each of you play a role in children's experience. And there are other roles as well, such as family members, teachers, therapists, doctors, childcare providers. Structures can be threatened by spotty construction and unpredictable weather. I would say that the COVID-19 pandemic and all of the ensuing fallout from that is a really good example of unpredictable weather. Adverse childhood experiences and other trauma can affect the construction, and even the strongest buildings can be affected by this unpredictable weather. So it's also important to remember that construction is a process, not an event. Ongoing work and maintenance is required. So that means, again, that trauma and stress can affect the building of the house, but it's never too late to address it, and everyone needs ongoing support to maintain well-being. So just tying this back into why we're here today, many parents do not know about what to expect as their child grows, especially with social emotional development. And there's harder when families have a lot of other concerns to deal with as well. So the more that we can share messaging and information, the more likely that parents are to hear it and implement it. The children you serve are more likely to experience adverse childhood experiences or social determinants of health. So it's on all of us to be an extra set of eyes in monitoring young children. Your children also may not have access to as many protective factors. So, we can help provide knowledge of child development and foster emotional competence and resilience in the families that we serve. Okay. So let's talk specifically about optimizing social emotional development through screening. And I thank all of you for chatting in. I do see that many of you are already using the ASQ and the ASQSE. So I'm going to be doing an overview of the ASQSE, but then I'm going to talk a lot more about screening online, best practices for screening, etc. So I hope some of that resonates with you, even if you are screening. So social emotional development. When we talk about social emotional development, we mean a child's ability to experience, express, and manage emotions, develop positive relationships with caregivers and others, and explore their environment with curiosity and confidence. Social emotional development is important for a child's ability to build relationships, and these skills are necessary for them to be ready to learn when they arrive at school. Additionally, social emotional skills are linked to overall well-being later in life. So your role is to help pass along this information, why early childhood and social emotional development are important, and how they can help support it. Screening is also a crucial part of this process, and you can help families understand why this is important. So when we talk about social emotional development, there are some quote unquote antisocial behaviors that are a normal part of development. For example, infants are going to cry in order to get their needs met, and toddlers are going to have difficulty sharing because they haven't learned how yet. So when we're talking about problem behaviors, we're talking about how frequent these behaviors are, how intense they are, and whether they are externalized behaviors such as hitting, biting, kicking, screaming, or internalized behaviors where a child maybe is painfully shy and is unable to make attachments with any others. And we also want to look at behavior through three lenses. The child's developmental age and stage, the context of the setting, and then along those lines, the family and community values and expectations. So a child may act very differently in one setting than another, but also depending on what the culture of that environment is and what the expectations are. So we're going to talk specifically about the Ages and Stages Questionnaire Social Emotional Screen. And this is organized along the Developmental Organizational Framework. So this is a framework that looks at the different tasks of each stage of development as a young child is growing. So in the first year of life, the task of that stage of development is forming attachments. So the behaviors that we would expect to see are regulation, recognizable states, attachment, the beginnings of communication. From 12 months to 30 months, the main task is developing autonomy and self-development. So we would hope to start seeing the child differentiating between themselves and others and being able to distinguish between real and make-believe. Because they can differentiate between themselves and others, they'll also start to use pronouns, they'll start to explore their environment, and they'll start to learn what the rules are and exhibit some self-control. And then between 30 months and 7 years, it's about establishing peer relations. So we should start to see empathy. We'll start to notice gender differences and have the child notice gender differences, identification of who their friends are and interests in other children. But most importantly, if problems begin at one stage of development and are not resolved, they compound as the next stages of social emotional development unfold. So looking at the ages that we're seeing in this framework, what that means is if there's issues in the first year of life in developing attachments, those issues may compound over the course of the next years, which shows that if we're not screening in the first year of life, we really should be, because that's how early we need to be intervening to make sure that the child has an optimal social emotional developmental trajectory. So the Ages and Stages Questionnaire social emotional screen is one form of screen. I know that there are other screens that some people use. I'm going to talk specifically about this one because we have a lot of experience using it. So it looks specifically for social emotional behaviors. I see that some of you are also using the ASQ3, which is the general developmental screen. The ASQ3 has a section on personal social, and that focuses more on ability to self-help. So getting yourself dressed, knowing names, etc. And it's only 6 questions. The ASQ social emotional screen goes far deeper into these. And unlike the general developmental screen, which has a concrete number of questions for each domain of development, so communication, fine motor, gross motor, problem solving, and personal social, the SE looks only at social emotional, looking along 7 key behavioral areas, which are self-regulation, compliance, social communication, adaptive functioning, autonomy, affect, and interactions with people. And unlike the ASQ3, the ASQ-SE doesn't have a set number of questions for each of these areas on each screen. Rather, it depends on what age the screen is for, and it'll focus on specific behavioral areas that we would expect to see at that age. So screening with both the ASQ3 and the ASQ-SE gives a more complete view of a child's development. The ASQ-SE can be offered to children from 1 through 72 months, and there are a few what we call age intervals for the screen. So a 2-month screen will cover, a window from 1 month to 4 months. I'm not exactly sure what it covers. There's a 6-month screen that also covers a window of age 12, 18, 24, 36, 48, and 60. The number of questions varies depending on the age interval, but it's 20 to 40 questions about things a child may or may not be able to do, and each has an option to note a concern. It also includes open-ended questions related to worries, as well as a question at the end about what the caregiver enjoys about their child. So we'll come back to that a little bit later. When interpreting or using the results, we want to look at those overall questions because there are certain concrete concerns like eating, sleeping, or toileting skills that would be addressed differently than other concerns. So those types of concerns, the ASQ has, tip sheets, for example, or maybe there's referrals to specific programs that would address those concerns. But we also want to be considering the child environment, the family's culture, whether or not the child has a developmental delay. An example of that is often if children have issues with their communication skills, they will also score really high on the ASQSE because their struggle to communicate can start to affect their behavior, and they'll start to lash out in other ways. Other factors that we want to consider, the ASQSE takes into account whether the parent is concerned about that behavior. So even if the behavior may not be concerning, if the parent is concerned, that's something we want to think about, because at the very least, there's something going on between the relationship between the child and the caregiver that needs to be addressed. We also have to take gender into account. Girls tend to score lower on average than boys on the ASQSE. So even if a girl scores in the monitoring zone, which again, we're going to look at how to score the screen. If the girl scores in the monitoring zone, we might still consider a referral because it's just far less likely for them to score high. And then in the monitoring zone, we want to make sure that we're continuing to monitor those that score the monitoring zone, that we're not just only taking into account children that score above cutoff. This is a really great opportunity to give activities and tip sheets to parents and to provide a new screen. So this is an example of what the screen looks like. And again, many of you, it seems like, already use this. This is the 6-month screen, the first few questions. For each question, there are options of, my child does this often or always, sometimes, rarely, or never, and then to check whether this is a concern. Unlike the ASQ3, the ASQSE is scored depending on the item. So the ASQ3 is relatively easy to score because every score of, not yet gets a score of 0, every score of sometimes is a score of 5, every score of always is a score of 10, and you add that up. But on the SE screen, it depends on whether the question is something that we would hope to see or whether the question is a problem behavior. So for example, for item 1, when upset, can your baby calm down within half an hour? We would hope that they can. And so we would hope that the score is often or always. So if the answer was often or always, it would get 0 points. That's why there's a little Z next to there. Because on the social emotional screen, the higher the score, the more concerned we are. Whereas, does your baby stiffen and arch her back when picked up? That is something that we might be concerned about. And so if the answer was often or always, it would get 10 points because that's a more concerning item. We would also, again, factor in whether or not the parent checked it as a concern. This is not a training on the screen, and most of you are already using it. So I really want to go more into best practice in implementing screening and referring for screening. So when we're talking about the social emotional screen, we do have a few different referral options. Unfortunately, is not as cut and dry as it is on a general developmental screen like the ASQ3, where if a child scored below cutoff, we would know that the best option is to refer to early intervention or to preschool special education. With social emotional screens, it's a little more complicated because it really depends on what the concerns are and what the situation is. There's always an opportunity to engage parents more in their child's development by providing activities and other guided engagement. And I'm going to spend a lot of time at the end of this presentation talking about that. But if there's a concern, again, it really depends on the issue. So in New York, the IDEA parts B and C are early intervention if a child is under the age of 3 years old, and that goes through the county's Department of Health, or preschool special education, which goes through the family's school district, and it can be a little bit more complicated. Those are always good referrals to make, but the reason I say it's not as cut and dry is that typically early intervention and preschool special education don't qualify you for services based on behavior alone. Like, there often has to be something else going on as well, which is why we want to open up options to other referrals. So this could include parent-child therapy. Sometimes parenting classes or support groups could be a good option. And I bring this up because I mentioned before that we're looking at parental concern. And like a good example is, maybe you're working with a family and you think the child's doing great, but you do a screen anyway because universal screening is good. And the child scores higher than you would expect, but mostly because the parent is indicating having a lot of concerns. It could be that the parent needs more support in parenting their child, and that maybe they don't know enough about child development. Maybe there's not really a goodness of fit between the temperament, and so it's the parent that needs more support than the child. And that would be a good opportunity to introduce parenting classes or other support groups. But sometimes a child really does need help, and maybe it's an issue of needing to socialize more. Maybe they scored really high because they're having difficulty creating relationships with peers. So a child play group could be a good option. So I know that's not a great answer because it's not super cut and dry, but there's also a lot of opportunities to address social emotional concerns. So when we're talking about screening, it's so much more than detecting delays. Screening should always be universal. And this is because, I didn't have time to add my slides in about what screening is and what it isn't. But about 15% of children have a developmental or social emotional issue. And yet we are only catching about 30 to 40% of those issues before a child gets to kindergarten. And if you think about why, I'm sure you can guess. School is really the first place where we're seeing children all at once. So it's the easiest place to catch issues, but we also know that makes it a little bit too late. The prime opportunity to intervene is in the first years of life. If we use developmental and social emotional screens, we can catch 70 to 80% of these issues early. And that's why screening should be universal, not just if we already have a concern. If we have a concern, it could be validating, but we'd also be missing a lot of children that are kind of flying under the radar. And that's why we should be screening everyone, and we should be doing it more than once. The American Academy of Pediatrics recommends that children be screened at 9, 18, and 24 or 30 months. That's specifically for the developmental screen, but it goes to show that that's talking about 3 screens by the time a child is 3. And New York State ranks one of the worst in the country for our screening rates as far as healthcare provider screening. So we also know that most families in New York aren't receiving those screens. So all that to say, if your screening is not universal, or if you're not doing it more than once in your program, that's something to consider. Screening should be used to promote child development, not just to detect delays. So screening is a really great opportunity to promote child development and engage parents in their child's development. The process of going through the screen can actually teach families about their child's development in a way that they didn't know before. Using the general developmental screen, for anyone that uses it, you know that you have to go through these different activities. So it's also a great opportunity to have a parent and child engage in positive interactions with one another. That's also why screens shouldn't hide in a drawer. There's lots of programs that screen because they have to, and so perhaps the provider does the screen to check off a box and put it in the drawer, and they'll make a referral as needed, but otherwise that's the last we see of it. We always say that the screens really belong to the parents, and it's an opportunity to have a conversation with them about their child's development and show how important it is. So the screening results should always be shared with the parents in conversation about what they mean. And it's a really great opportunity to also provide learning activities. So even if the child is doing well, let's celebrate those milestones and say, wow, your child is doing so well. Talk to me about how you engage with your child in their development. Here's some activities that you can do to keep up the good work. Activities should be provided to everyone, whether the child is doing really well or whether we're concerned about that child. And I'm going to get more to those activities in a little bit. And then finally, aggregate screening results can help us help children. So this goes back to my other point about screens shouldn't hide in a drawer. We shouldn't just be using screens for each individual child, although that's very important, but there's also an opportunity to look at screens in general in your program and start to look at, in the aggregate, how are children doing? are there certain areas where children are struggling more? And if so, is there a way that we can change, the curriculum, or kind of focus what we're doing with individual family visits to address those weaknesses? Or maybe, if you're an administrator, seeing that families or children are generally struggling in one area, can we provide more professional development to our staff about how to engage families in that area? So we're going to talk about online screening and how you can use screening online to help with those aggregate results. So other best practices for screening implementation. We're making it universal because, again, that'll help us catch issues that we wouldn't have caught otherwise, but also it'll help destigmatize it. If families know every family gets this screen, we do it because it's important, this is an expectation of the program, it makes it easier. And also making it routine. So we should be doing it more than once, like I said. Ideally, a screen, especially in the first years of life, can be done every 3 to 4 months if we're not concerned. And if we are concerned, you can be doing it every 2 months to kind of stay on top of it. So again, always celebrate milestones, always give activities. So regardless of the results, even if we're not concerned, we want to celebrate that. We want to give activities to make sure parents feel ongoing support for their child's development. Incorporating education around developmental promotion throughout your program. So this is a great way to do that. I'm going to speak more about Help Me Grow Long Island later, but we work a lot with providers right now, specifically childcare providers, around screening. And we say introducing screening is a part of your developmental promotion. So, maybe we need to look at utilizing other materials that you can give out to parents to engage them, and then say, screening is one part of this, but it's part of a bigger picture of how we're going to address general development and social emotional development in our program. And then using an online screening system, which I'm going to show you now. So if anyone uses the ASQ online, if you want to just chat into the chat box and let me know, I'd be very curious. For anyone who doesn't use it, the ASQ Online is an additional option from Brooks Publishing, which are the ones that own the Ages and Stages questionnaire screens. So you do need an annual subscription, and then you do need to purchase the screening kits and use the codes that they have on the box to make those available on your ASQ Online. But once it's set up, there's many benefits. The first is that you are able to get an online screening link for parents to complete. So if you already have parents complete it, it makes it easier for them. A lot of parents prefer to do things on their phone or on their computer. And then once it comes through, it's already scored and all the info is in there for your staff. So all you have to do is review the results. You can keep all of the screening materials in one place. So not only the screens, but activities, parent handouts, parent letters, etc. And I mentioned before about running aggregate reports. The ASQ Online gives you easy access to do that for you. So I'm actually going to switch gears to go into the ASQ Online. But I'm also going to take this moment to pause to see if anyone has questions or comments about anything that we've talked about thus far.
I don't see any questions in the chat yet, but I'll definitely relay if people ask anything.
Okay. And you can certainly flag me down. I know I keep a quick clip when I'm doing these presentations, but it's just because there's so much for us to cover and I want to make sure we have time. But certainly chat in or just jump in and interrupt me if you have any questions or thoughts. But let's look at the ASQ Online. Okay, so I am signing into a practice account, and this is what it looks like for individual providers that use it. There's also basically, if you are the one running your ASQ Online account, you have account access where you can kind of run overall aggregate. This is what it looks like if an individual provider is using it. So I could go in and for every child in my system, I can create a child profile where I'm able to keep several screens there. So let me see. Yeah. So for example, with this child, I've got all of the child's info, and then I could see any screens that I've done with them are all in one place that I could look at. I mentioned before about having an online screening link. So this is what we use with Help Me Grow Long Island, but you would be able to create your own personalized URL. So it's only then accessible to your account. And I could share that link with families. I can edit the information that's on that link so that it could be specific to my program and whatever information I want to share with families about that. But this is what it would look like. So a family would put in the child's date of birth, whether or not the child is premature, and then it will automatically calculate for you which age interval to give. Then the parent will be putting in all of their information. So again, that's one less thing for you to do. It would all automatically go in there. And once I do all of that, I then have access to the screen and it goes page by page, and I just answer the questions and submit it that way. Another great aspect here that I mentioned is the ability to run aggregate reports. So if I am a home visiting program that's doing screens, and let's say I have families do it online, or maybe I don't, maybe I'm used to having the home visitors complete it during their visits with families. They do it via paper, and then we have them, or we have one administrator go in and enter the results online, which doesn't take that long. I would then have access to aggregate screening results. So I could run a report on, let's see. This is not going to show me that much because this is a test account and we don't have that many screens in it. Let's see. I could run a report and see, okay, in our entire program, how many children were below cutoff, monitoring, above cutoff, etc. For the general developmental screen, I could see that broken out by domain to see, how are children in our program doing? And then I could use that to make decisions about the information we share with families, the curriculum that we have, the professional development that we provide to our staff. Another great thing is that all of the tools that you can get through Brooks Publishing, you can make available in this one portal. So that's also great if you're continuing to work remotely. All of your home visitors would have access to all of the screens via PDF. So you could either, download and print them, or maybe you're using them virtually. I don't know why this is being slow. Okay, so for example, if I'm going to a visit, I can find the questionnaire that I need and download it as a PDF. So that's all there. But in addition to that, if I've purchased and added codes for the learning activities, this is what I mentioned before about making sure that we are always providing information on how to promote a child's development when we do the screens. So if we're talking about the ASQ SE, so we've got ASQ SE learning activities. We've got specific tip sheets on body awareness, on calming a colicky baby, on calming, caring for yourself. And I have access to all of that. So let's say for my, sorry, it's freezing on me. There we go. So for example, if I wanted to provide a tip sheet on calming a colicky baby, that would be right there for me. And I could, have that in English and Spanish so that I'd be ready to give that to parents. I might give these learning activities to every parent that we complete a screen with. Sorry, I'm not sure why it's not popping up. We also have on here, let's see, a parent conference sheet. So this is great if I need help preparing for having a conversation with the parent about the screening results. So I could download this and I could first plan out like what the goals of the conference are. We always want to start with talking about the child's strengths. So, writing that out so that you could reference them, then areas of concern, and then agreeing together with the parent what follow-up actions to take based on the screening results and based on your conversation. And then, even making a copy of that and giving it to parents. This is just another tool to help support the conversation and to actually do something meaningful with the screen after you've done it. Does anyone have questions or thoughts about using an online screening system?
We did have one question come in about at what point do you not complete the ASQ SE? So an individual shared, I would have children score well over cutoff due to developmental issues, but I still have to do the SE.
So that's a good question. I mean, I think in that case, so the only cases in which we wouldn't necessarily have to do a developmental or a social emotional screen is if a child is already receiving services for that issue. There are times, like I'm not sure in this example how old that child is, but the younger a child is, the more likely they are to maybe be receiving early intervention services for a communication concern, but maybe not specifically for these social emotional issues. So it could still be good to do a screen for that and talk to the family about that. And then, based on the results, maybe the family would speak to their EI provider about opportunities to add in, like to address these other concerns, share that with their doctor, etc. So it's really only if the child is already receiving specific services for that concern that I would say, you probably don't have to worry about a screen at that point. It's not going to add any value. I hope that answers your question. Okay. I want to take some time to talk about Help Me Grow, not just Help Me Grow Long Island, but Help Me Grow in general, because it may be in your area in New York. So Help Me Grow is a systems model for improving access to existing resources and services for young children. And it does this by building collaboration across sectors, including child health care, early care and education, and family support. Additionally, because Help Me Grow, is trying to improve access to existing resources with the overall goal of optimizing child development, most Help Me Grows also provide universal developmental and social emotional screening. So as I talk about Help Me Grow New York, please know that all of the Help Me Grows in New York offer free universal developmental and social emotional screening. But the model works like this. So there's a few different parts that make up the model. The first being family and community outreach. So programs like home visiting programs are reaching families. How can we make sure that we're working with you all and that you are all are connected to other programs in your community that also serve families? And how can we also have unified messaging about how to promote your child's development, what to do if you have a concern, how to actually link to that service? Child health provider outreach is also really important because we know that 95% of children will see a primary care doctor before they go to school. So that's a great access point, but doctors are not always screening or they're not always trying to catch issues and connect families to services in a timely manner. A lot of doctors use a wait and see approach. But doctors also don't always know all of the amazing programs available in their community. So making sure that we're linking them in is kind of making them part of that network. The biggest aspect of a Help Me Grow is a centralized access point. So having one phone number, website, etc., that a family or provider can call with questions or concerns about their child's development, or really anything related to supporting their young child. So I'm going to talk specifically about how Help Me Grow helps connect families to basic needs, because that's a really important aspect of their child's development. But again, it's more than just referral. Referral is really the start. It's about actually making sure that families connect to that service through ongoing care coordination and follow-up, and addressing any barriers that might come up. And then finally, by having all of those moving parts coordinated in one way, we're able to start collecting data on how children are developing, what families need to support their child's development, what they're able to access, what they're unable to access. And then when we do all of that, we have a functioning system to support families. So I mentioned before that I work for an organization called Docs for Tots. We are the organizing entity for Help Me Grow in our region, which means that we help coordinate all of these different moving parts. Data collection also means that we're doing continuous systems improvement. So we're looking at the data to see what it tells us about not only the Help Me Grow system, but early childhood supports in our region or in our state in general, and how can we use this to advocate for a better system for families. And then scale and spread. So their Help Me Grows now exist in 4 areas of the state, and actually are geographically expanding. So I will get to that in a second. Help Me Grow models exist in over 100 communities across 29 states in the country, and it looks different everywhere it's run. So if you Googled Help Me Grow, you'll probably come across, many other systems that look very different. Sometimes they're state run and it's across the entire state. Sometimes they're only in specific areas. In New York, we are all community grown. So we're all kind of individual, separate initiatives in our own regions, but we do coordinate amongst each other. And now there's a little bit more state level buy-in into what we're doing. So Help Me Grow in New York, this map as of this week is a little bit outdated. So we are in Long Island, Onondaga County, Western New York, and Rochester. But Rochester will be expanding to, a few of these counties around with their comprehensive screening initiative. So if you live in any of those areas, just be on the lookout for that. And there is some interest in other parts of the state. So just because you may live in a region that doesn't have Help Me Grow doesn't mean you won't in the future. I'll give an example of how Help Me Grow Long Island works, if anyone here lives on Long Island. So we launched 3 years ago, and it's not a program or nonprofit, it's a system. It's coordinated by Docs for Tots, but it's in partnership with and overseen by representatives from over 20 different agencies across Long Island that serve families and young children. We provide free virtual and ongoing care coordination for families with young children. So kind of going back to the social emotional screen and how making a referral for a social emotional screen is not very cut and dry. Oftentimes programs that do a social emotional screen may refer to Help Me Grow, since we specialize in what's available for families for all of these different needs, and we continue to follow up with them and with you if you refer them. So it just makes it easier. We also offer free developmental and social emotional screening, both just for families to access via our website, and to partners that work with families. We train them for free, give them the materials for free, give them access to the ASQ online for free so that they can do that with their families. And so we work across sectors to make all of this work. So what this means for you, just partnering your community. If you do live in a community with Help Me Grow and you never heard about it until now, or maybe you did, but your program doesn't really engage, just consider looking into it, potentially using Help Me Grow as a referral resource, and just, again, in partnership for how you're already helping families. You may also partner to use the ASQ online system, because every Help Me Grow does have some form of screening online. So Rochester has their own data system, but the other 3 areas use the ASQ online, and we could offer that access for free, or, you know, even if you're already screening, we could give you access to using the online system. There's a lot of different ways to determine it. And if you don't have Help Me Grow, you know, are you sharing screening results with physicians or with other providers that serve families? Obviously with family consent, but making sure that that information is being shared for the best outcomes for the child. And are you linking families to other resources and helping ensure that they successfully connect to those resources? Because we know that if we just give families a number and hope that they call, they often don't. So is there a system or process in place where you can be following up and making sure that we're helping families connect to services that can help? I just want to flag here that there is also, for anyone that's already using the ASQ Online or maybe wants to use the ASQ Online, there's moves happening as we speak to create basically a state New York ASQ hub that could link all of these different systems together to create a statewide screening database. And the benefit of that would just be to see how children are developing across the state and directing efforts towards addressing issues. So currently, state grant funding is being used to put that together. So if you use an ASQ Online, you might receive a message in the next month or 2 asking if you'd be interested in linking up to that. So I just wanted to put that out there now so you had some context. Again, I'm going to pause. Are there any questions before I go into my last leg of promoting social emotional development?
None at the moment. I don't see any coming into the chat.
So I just want to make sure that everyone is aware of some free resources that are available to help engage the parents that you serve in their child's general and social emotional development. I mentioned before that I am an ambassador for the CDC's Learn the Signs Act Early campaign. For anyone who's unfamiliar, this is a research-based early childhood public health campaign out of the Centers for Disease Control with the goal of improving early identification of children with developmental delays and disabilities by promoting developmental monitoring so that children and families can get the services they need as soon as possible. So it does this by offering all of these tools for free that are geared towards parents or geared towards professionals to help us track developmental milestones. There is a website that I'll show you right now. It's the Learn the Signs Act Early website where you can find all of this information, including free materials, information geared towards parents. You know, if you're a home visitor, they've got specific tools that you can consider utilizing in your program. Let me go back to free materials. So all of the materials are available on the website in English and Spanish, and often many other languages as well, that you can download for free as a PDF and print yourself. You can also order for free from the CDC. The only issue is that it allows very limited quantities. So you don't have to pay for shipping or anything, but you're not going to get that many. Oh, they updated this. So let's look at my favorite are the children's books. So they've got children's books geared towards 1-year-olds, 2-year-olds, and 3-year-olds. And not only are the books developmentally appropriate stories for that age, but they also have tips on the bottom for parents on how to promote milestones. It'll also point out what the milestones are. So it's basically educational for both parents and children. So this is great if you're able to order a bunch or even print a bunch to give out to each of the families in your program. Maybe it's like after you do a screen, you give them a book, and it's just another way to engage them in their child's development. There are booklets that go through, here I can show you. As your child ages, some basic milestones to expect, how to help your child during their development, what to do if you're concerned. So you can give this to a family right when you start meeting with them, and then encourage them to kind of keep going through it as their child grows. There is also an app It's the CDC's milestone tracker app, which has all of these milestones checklists. So you can basically create a profile for your child, create a milestones checklist for wherever they are in their development. It has videos and pictures to show you or to demonstrate each of the milestones that it talks about. It'll tell you when to act early. It'll have a place to save your checklists. It has a place to keep track of doctor's visits. So again, another great tool to just promote amongst your families. You can order free flyers that are double-sided in English and Spanish that encourage the families to download the app. You can give that to all your families and then, talk to them about it between visits. Maybe you can encourage them to use that app. Okay. So other ways to engage families in their child's development. The simplest messaging that we always use is talk, read, and sing to your child because it's very simple, elegant, but it does the trick. There are tons of apps. So I mentioned the Milestone Tracker app. For anyone who's unfamiliar, there's also the Vroom app, which engages families in their child's brain development. So it actually explains how each of these different activities builds their child's brain. We love Bright by Text. Bright by Text is a free text messaging service that, depending on your child's age, will send out age-appropriate activities, tips, etc., from a national expert content library that has messages from 0 to 3, PBS, the CDC, etc. So it sends out all of those content messages, and then based on where the family lives, they may also receive additional local information. So for example, Help Me Grow Long Island is a national partner of Bright by Text. So that means that we can send families who are subscribers from Long Island, we can send them information on local resources in their area. So for example, during COVID-19, when there was a food distribution in their area, we would put in for the zip codes around the food distribution and say, hey, like if you need food for your family, you can go here at this time. So it allows you that local content information as well. So families can sign up by texting the letters HMG to the number 274448. Sesame Street also has a lot of great activities and resources. So they've got their Sesame Workshop, and they also created a specific Caring for Each Other COVID-19 resource at sesamestreet.org/caring. I will be sending all of these slides to Maggie to distribute, so hopefully you'll still have access to all of these resources. Again, if you weren't familiar already, we encourage you to check them out. It's never going to hurt to share that information with families, and they'll use what they want to. So in summary, are you utilizing existing resources to promote child development among parents? Are you implementing screening and referral universally in your program? Can you benefit from using an online screening platform if you are? And do you have Help Me Grow in your region? And if so, are you connected with them? So what now? I just talked at you for an hour. We hope that you share this information with families about the importance of the early years, how to engage with their child and their child's general and social emotional development, how there are free apps and resources to use. If you don't already know, find out what your area does for early intervention and preschool special education, other resources where you can refer families. Encourage your families to complete a social, emotional, and/or developmental screen, and partner with local entities. So if you have Help Me Grow in your area, contact them to find out about partnership opportunities. If you don't, just examine the ways in which you are currently working with community partners or linking families back to their healthcare providers, etc. So can you place the CDC website in the chat? Yes, I can. I'm doing it right now. And my next slide, I think, summarizes the websites. Yes. So thank you so much for your time. I can be reached at melissa@docsfortots.org. But here are some websites that I cited throughout this. And then the Help Me Grow New York website, I don't have on here, but helpmegrowny.org is where you can look and see the contact information for the different existing Help Me Grows in New York.
Thank you very, very much, Melissa. This was a very information-filled and just great presentation to listen to. I encourage folks to drop any questions with our remaining minute or so in the chat if they have any. If not, Melissa's contact information is there. I would like to reiterate that I will be sending a link to this recording as well as the slides with all of the links and information in a follow-up email. So if there are no further questions, again, just on behalf of the HVCI and Prevent Child Abuse New York, I would like to thank you very much, Melissa. We will be in touch with follow-up materials, and I wish everybody a great day. Thank you.